I have a question. We hear these terms like borderline personality, women who have this risky behavior that, risk taking. They'll go have sex in a bathroom when they're out to dinner with their boyfriend or their husband, or they'll do crazy stuff like that. What do you think of that? I mean, that label.
Well, borderline personality, there's a legitimate diagnosis for that, but sexual addiction is one of the options there. They could become just as addicted to shopping because to meet criteria, they usually have two addictions. Could be smoking, could be food, could be exercising, could be anything. Some of them, it looks more glamorous on TV if they're also sex addicts, right? Like we can think of some movies that go back in our history, right? And so, but I've never met a borderline that wasn't sexually abused. Okay. And so that shatters them in ways, and the way that they've dealt with it is by being this kind of impulsive, out of control, angry, not able to organize. Okay. And it's probably a lot to do with their brain more than anything because it's been through so much trauma.
I have a cocktail for borderlines because often I see they have low frontal lobe function. They also have an obsessive pattern in their brain, and their left temporal lobe is usually low in activity. And so stabilizing that really helps.
Absolutely.
Balancing their brain helps. But many of them, like you say, have trauma.
Right.
And if you balance their brain, and then we like EMDR, specific psychological treatment for trauma that can be so helpful. When I heard the chaos Tana grew up in, her ACE score, adverse childhood experiences, an 8 out of 10. My first gift to her was 10 sessions.
I'm like, don't shrink me. So I think I'm the opposite camp. I'm like very controlling over my environment, like martial arts, like very, very controlled.
You were going to be safe.
Absolutely.
You were going to be safe. At all expenses,
but at all costs.
Yeah.
Tell us a story that's like close to your heart on how your work has helped somebody.
Oh, I can tell you thousands. I mean, where a couple comes in. Yeah, I'll give you a general story. A couple comes in on Monday and they've been married for 20 years. He's cheated on her. She didn't know it, right? She finds out. She gets the truth on Monday and they start to repair. And what happens is love grows. Okay, he starts clearing up because now he doesn't have any shame. There's no secrets between him and her. Usually by Wednesday or Friday, they're being physically intimate. I mean, and we give them exercises where they look each other in the eyes and they pray, they share feelings, they build the blocks of marriage that they just didn't have the skills to do. No one taught them how to have a marriage. And we give them those skills and they start using them and instantly they start feeling closer and attached. And they leave holding their hands and feeling that they can do happily ever after. It's going to be work, but we can do this. Yeah. We're designed that we want to be healthy spiritually, emotionally, sexually, relationally, financially. We want that. And a lot of times you have to give people skills. Addicts miss skill development. We have a book called Emotional Fitness because they don't know how to process emotions. When they get overwhelmed emotionally, what do? Boom, they go off to their addiction. All addicts do that. And so when you teach them how to have their feelings and how to do that with their wives or their husbands and be present, now they have a place where the skill development can happen and intimacy can attach. And the neurologicalness of attachment can happen because they're looking into someone else with their heart. They're looking into another heart and they can see that person and be seen. And that's really what we really want, is to be seen and to be able to see the other soul. I love looking into my wife's eyes and seeing her heart. It's just like, wow, what a privilege.
It's amazing. But it almost seems like, because I've heard so many people talk about situations like this and they're not able to do that very easily. It seems like having the right person help you, obviously, and guide
your
you.
Intuition is so right. It
also seems like the spiritual component is critical, because if you don't have something beyond yourself and why you're justified in being angry, it seems like it'd be pretty challenging.
Well, all addictions use the 12 steps, and that's a spiritual program. But your intuition is correct in that someone who is an addict, they are causing pain, but our model, the first model of sexual addiction treatment, which Mark was part of, treated the addict, but didn't really know what to do with the partner or the marriage. Our model is triune. We treat the addict, the partner betrayal trauma, and the marriage all at the same time. So our results are expedited. She's not waiting a year to get a disclosure. She gets a disclosure on Monday. Okay. She can start doing her anger and grief and losses Monday. Okay. They can start doing couples work on Monday. Okay. And so as he's recovering, the marriage is recovering and she's recovering. So she's not staying in that rage for 8 months or a year. Because
how long is the program?
Well, it's a week.
So we
go for 5 days, right? But then you're in support groups for 6 months or a year because you want to be supported as you're going through the process, right? And a lot of these people end up helping other people, starting support groups where they are.
Well, that's the best way to get
well. Amazing.
Yeah, it is, because once you build a community of like-minded people, you can get there. And one of the best things that happens in intensive is not just the counseling, but they go into a room and we have community groups. And so these people they've been sober 5, 10, 15, 20 years, some of them. And they go into a group and they see a guy who's dumber than them and they go, wow, he's clean for 6 years. I can do this.
Oh, interesting.
Or a wife who's going through pain and going, wow, she's been here and she's gotten well. I can do this.
Right.